However, we would not recommend taking sleeping pills because most of the sleeping pills, the mechanism of action is to slow down your metabolism, slow down your breathing rate, slow down your heart rate, and this is precisely what we do not want at high altitude because our body needs to breathe faster, our body needs to have a faster heart rate in order to help us adapt to the lower oxygen level at altitude. So you might have heard of the climber's mantra of climb high, sleep low. What it means is that for every day of trekking, we would aim for a sleeping altitude of not more than 500 meters compared to your previous night. But during the day, I go for a hike that goes higher than where you're planning to sleep that night. So, for example, if you all came from Namche Bazaar and spent maybe 1 or 2 nights there, it would be good to go for a hike to one of the higher village in Kunde or in Kumjung, and to sleep. So these kind of acclimatization hikes are good for our body to acclimatize. Very important to listen to our body. So any subtle sign of discomfort, headache, nausea, loss of appetite, these are all the beginning of acute mountain sickness, and if we ignore these signs, then definitely it will become something that is more sinister. So it's very important to be flexible. Giving an example would be last week there was quite an unexpected snowstorm, and we have seen quite a lot of trekkers who have been stuck for days because of bad weather, and then in order to make up for their lost time, they wanted to ascend faster than usual, and this is how we are prone to get acute mountain sickness. So it is very important to factor in some flexibility in your travel schedule. And if you get any illness, it is very important to not to ascend further. Just hang around at this altitude until you're feeling better, and then decide whether it is sensible to continue to go up, or if you're not getting better, then going down would be the good answer. Okay, so risk factors of altitude sickness is basically the complete opposite of what we just discussed. So the most important risk factor for altitude sickness is going up too fast, not taking enough days for acclimatization, and the second would be overexertion. So we see here a lot of really fit athletes, ultramarathoners, marathoners, who end up also getting high altitude sickness. Actually, we realized, and in current studies, we found that physical fitness, age, and gender, these are not related to whether you are more prone to get high altitude sickness or not. But what's important is whether you are overexerting yourself. So we noticed that in a lot of athletes that come to our clinic, because athletes are usually very self-driven, they are used to overexerting, they are used to pushing themselves to the limits. Therefore, in our practice, we see quite a lot of athletes who ended up overexerting and then getting high altitude sickness. So no matter how fit you are, it is important to take it slow, listen to your body and not overexert yourself. And other acute illnesses, for example, if you're having a common cold, flu, for example, traveler's diarrhea leading to dehydration, these are all precipitating factors which can make you have acute mountain sickness as well. And having an inflexible timeline, Or if you're in a group and there's a lot of peer pressure for you to keep up with the group, and these are all risk factors. Yeah, if there's previous history of altitude sickness, then unfortunately it also means that you have a higher chance to get high altitude illness in your future trips. And of course, if you have a pre-existing heart or lung condition. Diseases. Altitude illness is a spectrum. From the mildest end, we have high altitude headache. So probably most of you have experienced it, myself included. All right. So it is usually a benign condition. So if you drink enough water, take a pill of paracetamol or ibuprofen, and it usually goes away. Right? But if we are ignoring it or continuing to exert ourselves to go up high, then we might develop acute mountain sickness, which would be headache plus other symptoms that I will talk about in the next slides. And if we continue to not do anything about it, then we will develop into a life-threatening condition called high altitude cerebral edema, which is basically the swelling of your brain. And this is an absolute emergency, and these people have to descend to low level as soon as possible, otherwise they can die at the mountains. And there's another disease called high altitude pulmonary edema, which is basically fluid in your lungs. So this can be, or this can coexist with acute mountain sickness, or actually some people would just present with us with lung swelling without symptoms of acute mountain sickness. Yeah, so it's important to separate these two diseases. But these are very common diseases that we see at altitude. Okay, so first of all, acute mountain sickness. It resembles a hangover. So the main symptoms will be headache, plus loss of appetite. You might feel nauseous. You might vomit. There might be dizziness, fatigue, feeling very, very tired. So the symptoms usually begin from 6 to 12 hours after reaching a new altitude, right? So it is very easy for us to disregard like a headache or disregard the symptoms, thinking that, oh, maybe I just haven't taken my coffee, I haven't eaten enough, I haven't slept enough, or like the cold is giving me a headache. Yeah, so it is easy for us to disregard that as being a symptom of acute mountain sickness. But so this is why I want you all to remember that any headache or shortness of breath above 2,500 meters is acute mountain sickness until proven otherwise. Okay, yeah. So indeed, these symptoms might be due to a lot of factors, but at altitude, most importantly, we should treat it as acute mountain sickness first, and then try to mitigate all the other factors that can contribute to why you're feeling unwell at altitude. All right, so if someone has acute mountain sickness, do you think they should go up, they should go down, or they should stay?
No.
Go down, right? Mm-hmm. It depends. It depends. If it is mild form of acute mountain sickness, then we can discuss whether they have to go down or they can stay at this altitude, rest for a day or two, and see how it goes. The only wrong answer is to go higher. Okay? Yeah. So very important is to rest and drink plenty of water. Yeah, again, taking ibuprofen and paracetamol to ease the headache is a good idea. Sometimes people would fear that taking these drugs might mask the headache, which might be due to a more sinister cause. But this is a misconception because if the headache is due to a more serious cause, these medications will not help with the headache. So if you do experience any headache at altitude, we do recommend taking some form of medication to ease your headache. Like ibuprofen and paracetamol are great choices. Are any one of you currently taking Diamox?
Yes.
Diamox, right. Okay. How are you taking it? Are you taking it for prevention of acute mountain sickness?
Yeah.
Yeah? All right. Yes. Are you taking a half a pill 2 times daily?
We are taking 250 twice a day.
Oh, okay. All right. Okay. 250 twice a day. Okay. So the dose you're taking is actually a treatment dose. Okay. So we use this dosage to treat acute mountain sickness. So in the later slide, I will also talk about the preventive dose. So usually we recommend just half a pill or 125 mg twice daily of Diamox as a preventive dose for acute mountain sickness. It doesn't mean that what you're taking, like the dosage that you're taking now, is harmful to your body. But it's just that from current recommendations or like current findings of research, it was found that a lower dose can also prevent you from acute mountain sickness. But yeah, so this dose, 200 mg twice daily, is a good dosage for treating acute mountain sickness. So what we usually do is we'll see the patient again after 24 hours. If they're feeling much better, there's no worsening symptoms, then actually they're okay to continue to go up, but at a slower rate, right? But if the person is not improving, then we really would recommend them to go down if the symptoms does not improve within 1 or 2 days. So at the emergency end, this is the high altitude cerebral edema, so which is basically fluids in your brain. So what causes it is that when there's less oxygen around us, because our brain is the vital organ, right? So our body wants to increase the blood flow to our brain to provide more oxygen to our brain. And in this process, actually the blood vessels in our brain becomes a bit more leaky, and so fluids leaks into our brain tissue. So how would a person with haze present? They will have AMS symptoms, plus they can be confused, disoriented, they can present with some hallucinations, they have trouble walking and falling a lot. So we like to ask them to demonstrate a heel to toe test, which is to try to walk a straight line by touching your heel to toe like this. You'll be amazed at a person with haze that they will not be able to follow this command and walking in like very stumbling gait. Drowsiness, and also in the most severe form, the person might come in with loss of consciousness. So basically the symptoms, if you remember, AMS is like a hangover, then haze would be something like drunkenness. Okay, so again, this is an absolute emergency, and the person must go down, otherwise they can die in the mountains. So going down is the only treatment for this person, and one should never leave the person alone. So for one example is that we have seen a porter who has developed haze in Lobuche, and it was so lucky that he was coming down with a friend, because on his way down he suddenly became confused and started going back up again. So imagine that if he has no companion, then definitely no one knows what the fate of that porter would be. There are some temporizing measures which can help us buy time if the person is not able to go down because, for example, of bad weather or because it's nighttime, there's no available transport. So giving them oxygen you can see drastic improvement of a haze patient, and they can become a whole new person. They can go from a confused state to talking to you like really sensibly and walking in a straight line. And if oxygen is not available, have you heard of the camel bag or high pressure bag, or like a more scientific term would be a portable hyperbaric chamber? Yeah. Okay, so it is usually in big climbing expeditions, there will always be a high pressure bag like this. If you're interested in a demonstration, we can also demonstrate it with a cost of 300 rupees. So what it basically does is it increase. So it is a bag made of like plastic materials like this. Okay, so one person have to keep pumping the bag while the sick person is inside and sealed. And the aim is to increase the pressure of the bag to 2 psi. Yeah. And what it does is it will simulate a descent to 2,000 meters from the current altitude. Yeah. So again, you can see drastic improvement when the patient is in the bag, like where there is like a simulation of going down 2,000 meters. However, the downside is that once the person is in the bag, you have to keep pumping all night long in order to maintain the pressure. Otherwise, like the pressure will not sustain, and the person will go back to this altitude again and develop haze again. So this is a measure only used when there's no oxygen available and where there is no means to descend down the mountain, like when people are stuck in the mountain in very bad weather. And there are some medications that we can give. One would be dexamethasone, which is a kind of steroid, and also Diamox is also a drug that can help us buy time for the patient. Yeah.
See these bags with diving, when it comes to diving, they're using similar to try and if they I say called ascent quick, they need to pump up pressure so they're getting the same pressure as they're down underwater, and then they can release pressure slowly to avoid diving sicknesses. But how would it work? How can you get a person in that bag at maybe 6,000 or 8,000 meter high and create a lower pressure? How do you get a lower pressure in the bag?
I can help with that. So yeah, my interest is diving medicine too, so I love this comparison. So the difference between these portable hyperbaric chambers and the chambers that we use for diving emergencies, for like the bends or for decompression sickness, is that these portable chambers can't go nearly as high pressure as you need to treat a diving emergency. So you won't see these portable chambers on like boats or anything with diving. You really need a physical chamber that can withstand a much higher pressure than these do. But these are really helpful for the high altitude sickness because it doesn't matter where you are in your altitude, you will always, as long as you pump that bag, you will always get to an elevation equivalent to 2,000 meters. Oh. So that's obviously that's not good enough for diving medicine, but that's great no matter whether you're at this altitude or whether you're at 6,000 or 8,000, crazy 8,000 meters. You will always be able to get that bag to an equivalent of 2,000 meters as long as somebody's pumping it. But like Dr. Lai said, it's a big deal to put somebody in this. You can't just be like, oh, let's just throw them in the bag and we'll check on them later. Like you need, like, your entire team is awake all night pumping this bag. So you only do this when this person like absolutely needs a helicopter evacuation, but for some reason you can't get that.
Thanks.
Yeah.
Thank you. After that we can talk about high altitude pulmonary edema, which is fluids leaking into our lungs. So it is due to high pressure accumulating in our lungs that again causes leaky vessels, and that causes fluids to go into the air sacs in our lung. Again, it may or may not be due to, it may not be related to acute mountain sickness. So we found that only about 50% of people with high altitude pulmonary edema, HAPE, actually preceded by acute mountain sickness. Yeah. And it's the most common cause of death at altitude. So the symptoms usually start 2 to 3 days after reaching altitude. If you recall, acute mountain sickness started to appear 6 to 12 hours after you reach an altitude. So for HAPE, the symptoms start a bit later, like 2 to 3 days after you reach altitude. So very often the person will experience breathlessness at rest. For sure, it's common for us to feel a bit breathless when we're taking a quick walk or we're walking uphill at altitude. But these people, they are breathless even just sitting down. And they cannot keep up with the group, even though initially they might be at the front of the group, but if they are falling back and not able to keep up with the rest of the group, then this is a warning sign. So usually it will also start with a dry cough, and then soon the cough becomes pinkish and frothy, and it basically means that there's blood in the lungs that the person is coughing out. Yeah. So HAPE is also an emergency and can result in death unless the person goes down as soon as possible. So treatment of HAPE, again, descent is the only right answer. And like HACE, we also would not want to leave that patient alone because they can deteriorate very easily, and we certainly would not want them to go down by walking. So in wilderness medicine, very often, if the person is able to walk, we try to encourage them to walk down by themselves. It's just easier in terms of how we, if there's not enough people to help them go down, then of course if the person can get down by themselves, it's preferable. But not in the case of HAPE, because just very minimal exertion can also worsen their symptoms. So HAPE is the kind of patient where we always want them to go down with the help of an animal, like going down by horse, or preferably by helicopter if that's manageable. And again, there are some temporizing measures which can help us buy time as we figure out the evacuation plan. Oxygen, and the other is the Gamel bag, the same high pressure bag is also helpful. And a medication that we would give is nifedipine. So it is a medication usually used to treat high blood pressure, but what it does for HAPE is that it reduces the fluids in the lungs, and this is a great drug if the patient is stuck at altitude. Okay, so coming back to Diamox, so it is great that some of us are taking Diamox as a prevention for acute mountain sickness. However, very important to note that there is no substitute for a proper slow ascent profile. So even though we're taking Diamox as prophylaxis, we should also still follow the rules of slow ascent. So like a preventive dose of Diamox is especially helpful if you have experienced previous episodes of acute mountain sickness, or like if because of certain reasons you have to ascend faster as usual. So this is not for like trekkers or travelers, but more from military people, like they might have to end up in a very high altitude in a very short time. So diamox would be very helpful, and like some of them would even use dexamethasone as a way to prevent them to get high altitude illness. But for most of us who are in the mountains for recreational purposes, it is very important to respect the rule of slow ascent. So how does it work is that, remember at altitude that we're peeing more because our kidneys want to excrete a substance that, and then that will make our blood a bit more acidic. And by making our blood acidic, it would drive us to breathe faster, to breathe in more oxygen, yeah? So diamox is actually helping with the same process. So it helps the kidney to excrete that substance, yeah, in order to improve our breathing rate. Okay? So it works in the kidney predominantly. So it is a great drug to help us actually adapt to high altitude. If you're pregnant, if you have a severe sulfur allergy, then make sure you let your doctor know because these are the contraindications to diamox. Have you noticed some side effects after taking diamox?
I think maybe it's in the fingers and what's it called? Tingling
Sensation, yeah? Yeah, so one of our doctors, Dr. Prince, he would like to say that, okay, this is not side effects, this is just signs that the drug is working for you, yeah? And if you have a chance to try some fizzy drink, like a carbonated drink, soda, whatsoever, it's an interesting experiment as well, because it was found that if you take diamox, then the fizzy drink would actually taste flat. Yeah, so if you have the chance to try it, yeah.
The Coke doesn't taste the same.
Oh, really?
Yeah.
You did try it. Yeah. So we talked about the preventive dose, which is 125 mg twice per day usually. The treatment dose is twice the amount of the preventive dose. And there's also a condition which diamox would be helpful. It is called sleep periodic breathing. Have anyone had problem with breathing or just suddenly woken up in the middle of the night? Okay, so sleep periodic breathing is actually a phenomenon that a person suddenly stops breathing for maybe a minute and then starts to breathe again while they're sleeping. So how it sounds like, if like say I'm a snorer, how I would sound like would be something like and then the person, because they were not breathing for some time, the brain tells them to, okay, you have to get breathing again, and then the person will be woken up from a sudden, like a short period of apnea. So it's very similar to sleep apnea, but just a different mechanism. So actually diamox is a great way to treat this condition as well. But if you're having like a preventive dose of diamox, then probably this is why you don't really have this sensation at night. Yeah, so this is a summary slides for the acute mountain sickness that we talked about. So this is a person with early acute mountain sickness. So it resembles like a hangover, severe headache, feeling nauseous, not taking any food. And in the more severe form, the person might be vomiting as well and feeling severely fatigued, not able to sleep. And this is a strong indication that the person has to go down and should not be staying at this altitude. And this slide shows the emergencies at altitude. One is haze, so high altitude cerebral edema. So you can see that the person has severe headache and vomiting, feeling dizzy. They might be confused And very classically, they are not able to walk in a straight line, like they look really drunk. And definitely they should go down at once and with someone to accompany them. And for HAPE, pulmonary edema, the person will feel very short of breath at rest. They might be coughing up blood or like a pink froth as well. So these people also have to go down. But most importantly, they should minimize exertion. So we always recommend that they go down either with the help of an animal or by helicopter in order to not make their symptoms worse. So there are other health problems at altitude. I'm sure these few days you might have also experienced a bit of a sunburn. One interesting fact is that for every 300 meters rise in altitude, there's actually 4% greater of UV light penetration. So yeah, this is why sunburn is such a big problem as we ascend at altitude. The other problem is snow blindness, which is basically the sunburn of our eyes. It is completely a benign condition. There is no long-lasting effects of your eyesight. However, it is extremely, extremely uncomfortable. So if you're walking on snow and forgot your sunglasses, then you will soon experience like a very gritty sensation of your eyes and tearing quite a lot. And this usually lasts for about 2 to 3 days. So it's basically sunburn of your eyes. So how to prevent this is of course to have good sunglasses, even though like in cloudy conditions, because UV light can still penetrate through clouds, and also if you're walking on snow, then definitely there's a lot of reflection from the snow on the ground. So it's a good idea if you're walking on snow to have some sort of glacier glasses or like a snow goggles to protect, to shield off the side of your face so that the sunlight would not enter your eye through the gaps here as well.
We're spending time on that because we have seen double-digit number of patients with this. It's, again, benign condition but miserable, and we've seen over 20 already, like this past week.
Yeah, yeah,
and just that.
Yeah, and one of the day that we saw the most patient is actually quite a cloudy day. Yeah, it was a cloudy day, and it's just that most patients forgot about the sunglasses and still got this. Another condition, which is more common in climbers, is eye hemorrhages. So hemorrhages within the retina of our eyes. So people who get this can be very terrifying because there might be some loss of vision or some blurred vision. However, it is transient. So it is usually relieved when the person goes back down. Yeah. And there's usually no long-lasting problems for the eyes. Hypothermia and frostbite is a real problem here. Again, an interesting fact is that for every 100 meters, 150 meters increase in altitude, there is at least 1 Celsius colder. All right, but you also have to factor in wind chill and other factors. Yeah, the lack of sun, and these will further cause us make us more prone to hypothermia and frostbites. Sleep periodic breathing we've discussed, and you might also have realized that there's swelling of your feet, of your fingers. These are completely benign and very common to be found at high altitude. Yeah, just be a bit more careful about your shoes, because like if your shoes are become tighter because of your legs, because of your toe swelling, then compound with the cold weather, you are more prone to get frostbite. Yeah, because of like your shoes compressing on your swollen toes and impairing the blood supply to your toes. Yeah, so just be careful of that. And in this area, we're seeing a lot of yaks. Yeah, they're helping us to carry a lot of stuff. Okay, so and also they look very adorable, and certainly I'm sure probably you have snapped some photos of them. Be sure to stay at far distance from them, because we certainly have seen yaks that have attacked some of our patients. So yeah, yak attacks. So they've rammed into our patients when they've come too close. Yeah, so certainly stay at distance with them. And here there are a lot of stray dogs, and in this locality, rabies is a genuine problem compared to where your home country is, probably. And unfortunately, we do not have anti-rabies vaccine. And the closest hospital where we can get rabies vaccine, if you're bitten by the dog, and we're worried about, okay, could it be a rabies or not? The only treatment is to get rabies vaccine to prevent rabies, because it can be a deadly disease. So it would just be a kind of a dumb way to end your trip early if you have to go down to Lubla because of a dog bite. Yeah. So problems. I would like to talk about carbon monoxide poisoning. So here we're lucky to have hot showers, which is mostly fueled by gas stoves. So you would notice that in your hot showers, usually one of the windows are open to keep the air current. Otherwise, with the gas stove, it is very easy for us to get carbon monoxide poisoning. And the other issue is HAVE, high altitude flatus expulsion. So it is a proper medical term, and it is completely normal for us to fart more, to pass gas more at altitude. Yes, just choose your sleeping partner well, and choose to follow who to follow as your trekking partner. So what it means is that, like as we discussed, that air expands at altitude. So the air within our guts expands as well. So this is why we have more flatus at altitude, and it is completely normal. Gastroenteritis. Here, unfortunately, it has the highest rate of travelers' diarrhea. Most of them is viral infection, but also bacterial. And if the symptoms last for weeks, like if you go back home and you're still having diarrhea, then probably your doctor will be suspecting a parasite infection as well. And the most foolproof way to prevent this is really to boil the water before drinking, or if you have filtration devices or like purification devices for your water, then it's fantastic. Yeah, and have you heard of Kumbu cough? So so it is actually a dry cough that is named after this region, because Kumbu region, this region is at altitude, the air is drier than usual, so the dry and cold air irritates our airway and makes us more prone to dry cough. So a good way to prevent this is to have a buff, so that you can breathe in your humidified air. So something that this guide has been putting on. So this buff right here. So if you're hiking, what I also like to do is just put it over my mouth so that I'm breathing in warm and humidified air to prevent this Kumbu cough. All right. So a slide about porter and guides. This slide means a lot to me. Yeah, I care deeply about the porter and like the health of porters and guides here. And first of all, do you know the difference between Sherpas and porters?
Yeah, doesn't the Sherpa lives up here, and the porters come from lower? Right. Yeah.
Yes. So Sherpas, they are descendants from the Tibetan plateau. So they have migrated to this region about 800 years ago. So Sherpas, this ethnic group, they have genetic advantage to adapt to the lower availability of oxygen at altitude. But still, it doesn't mean that they cannot get high altitude sickness. if they overexert themselves or if they do not acclimatize properly, they can still get acute mountain sickness. Yeah. Conversely, porters, yes, you're absolutely right. Most of the porters, they are from lowland Nepal. So these ethnic groups, they have absolutely no genetic advantage at altitude. And yeah, also considering that they are carrying a very heavy load. If you have passed by, I don't know, the Annapurna Base Camp, when I was here, they were setting up the Annapurna Base Camp over there, and I've witnessed like seeing porters carrying 100 kg of stuff, like 100 kg of mattress bed, gas stoves, whatsoever, and yeah, hiking up really steep terrain, and like these kind of overexertion makes these kind of porters very prone to get acute mountain sickness. Yeah. So it is the duty of trekking companies to take care of their porters. Unfortunately, there is no good law enforcement or a good law to restrict how much porters can carry, and especially that the amount of weight that the porters carry is really their source of income. So it's also like they have a huge financial incentive to carry as much weight as they can try to afford. Yeah. So now that you know about acute mountain sickness, now that you know what people are more prone, or what kind of activities make people more prone to them, or what are the signs of acute mountain sickness, yeah, it would be a good idea to also pay attention to your guides, to your porters, make sure that they're doing fine, because they are the people very vulnerable in this area to get acute mountain sickness. And Himalayan Rescue Association, our organization, all the fees that we generate from our sales, from our consultations to foreigners, these income allow us to treat porters, treat guides, and treat the local population at a very low price. So the local population are charged 50 rupees for all sorts of healthcare services that we provide. This is the main mission of our organization here. So, in summary, it is always exhilarating to be at altitude. The mountains are absolutely beautiful, but it is very important to respect the mountains, respect the altitude, and respect the rules that we should ascend slowly, regardless of how fit we are. Yeah, okay? So remember the golden rules of altitude, which is to ascend not more than 500 meters of like the sleeping altitude compared to the previous day, and take a rest day every 1,000 meters increase in altitude. Remember the symptoms for acute mountain sickness. Take care of your porters, your guides, take care of your buddies as well. If you are symptomatic, never go up. And if the symptoms gets worse, then the only right answer is to go down. Okay. Remember the absolute emergencies, which is HAPE, fluids in the lungs, or HACE, fluids in the brain. Okay? And never leave a person with high altitude sickness alone. Okay, so thank you for listening. Any questions are welcome, and also you're more than welcome to look at our merchandise. We sell t-shirts, we sell fleeces, beanies, scarf, stickers, patches. You're more than welcome to try out any of them. Yeah. Okay.
Thank you.
Thank you so much.
Very much.